I was kind of surprised by that. And the same is true of, broadly speaking, legal services. We didn't see a lot of families being referred to you from any legal services in your community. So I know those are few and far between, so maybe that too ought not be a surprise. I will just briefly say that we had been tracking through our Sooner Start liaison, we had been tracking referrals that came from Sooner Start to home visiting programs. And there are a few that we haven't been able to account for in this plot. We think it is because the plot is only showing us the referrals sent to you that were accepted. And so some of those that we know Sooner Start sent your way likely sat in that intake, I call it purgatory, the purgatory ETO fields, not yet assigned to a program. And they never did get assigned to a program, potentially because they were not eligible. But I do want to pause here while we have a captive audience and ask directly, is this an accurate reflection of the referrals coming from these referral network partners, during the innovation project and historically? Any of you feel strongly that, no, we do get these referrals and your numbers are off?
I asked all of the agencies this question during last month's rounding calls, and no one remembered receiving any referrals. And so I'd say it's accurate.
Okay, I paused to give people a chance to change their mind on that, but it sounds like that is accurate. Okay. Andrew, do you happen to remember where these referrals were going? They're all Safe Care. Do you remember which Safe Care program? Is it across all Safe Care programs, or?
We were able to determine two of them were from North Care, which are no longer attending our monthly calls. I can't remember what the third one was, but I can look that up real quick if you need me to.
Those are the ones that we had been tracking. I'm not sure those line up with what we have in our plot. Andrew and I were going through that earlier today, Tabitha, that those started coming in April of last year. And in this plot, you can't see it very well, but this is June of 2024. Everything else is before that.
I see.
Yep. I would have to double check to be certain which programs these are going to. Ethanol edge collapse within a model. These are just all referrals into some Safe Care program.
Yeah, okay, that's what I thought. All right, I'm going to move on. That was objective one. It'll be descriptively presented in our final report. As I said, there's no statistic we can really apply to this because, for one thing, there is no metric or benchmark in the historic period for all three of those network partners. Objective two, outgoing referrals. This was a focus, right? And we would be really sad if we didn't see any improvement here, or at least any activity. We see lots of activity, and we see things that we thought we would see, but you never know. This busy plot, I'm going to try to explain it in a lot quicker version than I did this morning. So the faint black line that I hope you can see in these gray dots, that's real data for your programs collectively. So we took all, what do we have, 11 programs here, combined you into one bucket and counted up month to month how many referrals went to Sooner Start. And these are the counts that we got. The red line that you see is a model that we ran, a statistical model that we ran, trying to predict, think like stock market forecasting here. We're trying to predict the average number of referrals month to month. And this used the entire timeline. So we started at the near beginning of ETO when we thought we had pretty reliable data, where this pattern seemed to be pretty reliable. And we went all the way out to present day. And I think this is about a month ago at the end of this purple area. Okay. So the red line uses all that data and it tries to predict across that entire timeline what the average looks like. The purple line only uses the data to the left of this vertical line. And I don't know if you can see this very well, but that vertical line represents, roughly the start of COVID. And what's interesting is that if you use the data prior to COVID to predict what's going to happen after COVID, it looks very different than the red line. And notice that they're not all that different in the early days during the pandemic and even immediately after the pandemic, but they do separate here in these latter months. And that we thought was promising because This is innovation project timeline period. And when we put it under the microscope further and look at, all right, when did the learning session and the PDSAs really get started? So just replaying history that you already know, we had you design your PDSAs for either Sooner Start or Lasso in January of 2023. But we didn't have Unitas set up yet, and so we kind of slow played the start of that. And it didn't look like there was much activity on referrals to Sooner Start in this case until about March of 2023. So that's where that vertical line is positioned right here. And you do see that same statistical models being run here. If you use all the data for the red line, you can see that we see a sharp increase after March of 2023 when these PDSAs have started. And if you use all the data prior to that and predict out or forecast what's going to happen after the vertical line, that's what you see with the purple line. So again, what we expected, we thought we'd see more activity after the innovation project than we did before. Seems to be coinciding with the start of those PDSAs. A little bit further under the microscope, we thought, well, what about when Unitas is actually live? And so if you do it when Unitas is live, this is what you get. And again, we see that sharp rise and some clear separation here between red predicted averages or moving averages, actual averages month to month, and then the purple, what we would have predicted if Innovation Project or Unitas in this case wasn't around. So I think it's positive news. It's not very precise. I mean, for one thing, if I go back a slide, we're seeing increases here without Unitas around. So it's, Unitas is not the only secret sauce. And we think the changes you made to your referral processes in-house, we think the liaisons, right, that human element of shepherding these referrals once they're made, all of that probably contributed to the increase. But it is a positive sign. So kudos to you all for the impact that the CQI work you did achieved here or realized. All right, that is the setup here for Lasso as well. So now we're looking at Lasso data. Mind you that it looks like the referrals are a lot lower, but actually the counts are higher here. We had to just kind of condense the plot. And also it's a lot tighter month to month. So there is a lot of activity happening here. It just may not look like it relative to the last few plots. Same setup. Here's pre-COVID. Here's what's happening after COVID. That was not all that interesting. Here's what we do when we look at the start of the Learning Collaborative. The start of those PDSAs. And notice we get an immediate flurry of activity here, off the chart numbers essentially, for a couple of months. It comes back down, but it's still higher than what we would have predicted historically. What happens when Unitas starts? Well, we do get that bump beforehand, right? So we know it's not all about Unitas, but we do see an increase over what we would expect, even when Unitas is in the picture here. That's Lasso. The last one is for PCAP. This one's a lot simpler because there's not a lot of services available pre-COVID. You can see that COVID didn't really have much of an impact here. There's not a lot of activity before COVID or during COVID. There's really not a lot of activity until right around the time that Unitas started and around the time, not Unitas started, actually around the time that you kicked off your final PDSAs, where the vast majority of you focused on referring to PCAP. So as we've talked about before, a lot of these referrals did not result in utilization. Some of these weren't even eligible for services, but we do see a flurry of activity here. So again, kudos to you for successfully increasing the awareness of this program, your screening of the clients for the program, and your actual referrals to the program.
I have a question, Dr. Barton. This is
Yes,
Pat.
Patty, go ahead.
Do you know if last week, I think it was a week and a half, we heard from the only client that we referred to the PCAP, and she told us that they told her that there were no more funds, that they just dropped her. And it was like not even referred to another program. So we thought that they were going to serve the family.
Yeah, I was going to save this one till the end. We got some bitter news about a week and a half ago from the PCAP program. There's a funding crisis, and they've had to close their doors in Oklahoma County. They had to do the same in Tulsa County maybe a month prior. So really difficult message to send out. I have been waiting for the go ahead, which we now have, to announce it to the group. So we decided we would start with today's monthly call, and then I have a formal email I'm sending out to you that the PCAP program crafted. But it boiled down to funding. Let's see, in the email at least that we have received and the information that we received from the program, their objective was to find all existing clients new homes with other service providers. So I think they're actively working on that. I'm sure it's difficult given the lack of programs that are available everywhere, but I know that that's their intention.
Okay, so we should tell her that maybe they're gonna get back to her to try to refer
Yes.
to a program.
Yeah, and
They
offline,
reached
if you
back to
want to
us,
share.
but we have graduated the family, so they wanted us to find a program, and we were like, I don't, we clueless about it, so we were hoping that they could do that. This is a an English speaking client, so maybe it should be that difficult.
Yeah, that should be easier for sure. Lisa Deshay, do you know, who's the right contact at PCAP?
I would say Aaron, because everybody else's jobs are ending.
So I think the director, Aaron Mayer, would be the right person to connect you with, Patty, and I'm happy to do that if you want, if you like.
Okay, thank you.
Yeah, we really wanted to get the word out to you, but PCAP had an obligation to tell their clients first, so their clients wouldn't hear it secondhand. And we didn't want you to hear it secondhand either, but we had to defer to PCAP respecting their clients.
Yeah, the timing is never good, right? But especially around the holiday time. So the staff are having to find new positions and trying to find and transition these clients, new service providers. It's been difficult to hear. Go ahead.
I'm sorry. Is there a way like that we can help support? Like we've only had one client that was actually in the program that she was participating in the program before we referred her, but she's had a lot of like issues going on. She relapsed, lost her child. There was another situation last week. So is there a way, like any resources that they have that we can also share that we can help support the family with? Are you aware of anything like that?
I know they do have a list of other service providers because that's when they were assigned for the clinical trial that they were running, when they were assigned the service as usual condition, they would give the flyer out. I think we may have a copy, and I can see if I can get the latest version of that and circulate it to everyone.
Yeah, I think that would be helpful just so we can provide that additional support.
Okay, Lisa Deshay, will you help me with that? Let's make sure I include that in
Yes.
my email to Aaron. Yeah, somber news. I'm sorry to have to be the one to break that to you. The program wanted to be here today, but their scheduling didn't work out. They were able to meet with our steering committee of stakeholders who've been invested in your work behind the scenes since the beginning of the innovation project, and they broke the news to that crowd 2 hours ago. Okay, I'm going to transition to utilization real quick. One of the reasons we were interested in Unite Us, one of the main reasons we were interested in Unite Us is closing the loop here on communication with your referral network partners. We thought that might translate into higher utilization rates, right? If we can create more communication circulating between the two programs, maybe we'd have higher success of getting families to engage in those programs. For the most part, we're not really seeing that, and certainly not at the level that I think everybody would hope and expect. This is historic and then more recent data. It's now split up by month because utilization rates or utilization numbers are small enough that monthly data just doesn't do it justice. So this is yearly utilization. The size of the dot, you're familiar with this from your CQI dashboards, represent the number of referrals. So we're seeing a lot of referrals go out from PAT to Sooner Start historically. Utilization rate, kind of peaks at around 30%. And we were seeing that rate, 5 years, 6 years ago, and a little bit of a decline during the pandemic. We've still seen a decline even in the last 2 years while we've been working on this project. Safe Care saw a bump, incidentally, during the pandemic, interestingly enough, and that came back down to more historic numbers in 2022, 2023, a slight increase, but then haven't had much success with utilization in 2024, although the referral count's low. C1, we do see an increase, right? It's coming up. It's coming up, I would suspect because the program was diverted to other activities during the pandemic. So there were a few referrals going out, but not a lot. And so utilization rates would be expected to be low. We're seeing it go up again for all programs. I'm sure this is not what you're hoping for. I would, hope that more families engage in the service. Now, definition-wise, just so you know what you're looking at, we're trying to be liberal here with what we call utilization. So this is documented evidence that the family did engage with the service provider. That could just be the intake visit, though. So it doesn't necessarily mean they've actually started getting an intervention. But if they completed that intake visit, we qualified it. Even then, we're seeing rates that are at this level. So quick pause for feedback. Any surprises here? Okay, I'm not hearing any. So I'm going to move on to LASSO. For the Safe Care program, a little bit more activity traditionally with legal services. And the response rate, or I'm sorry, the engagement rate here, hovering around 50%, up to 75% even in more recent times. And it's been on the decline. Sadly, we've seen it decline even during our innovation project. C1, we see a very similar pattern to what we saw with Sooner Start, and PAT, sort of a steady rise here over time, a little bit of a drop off here in 2024. And again, just relatively speaking, I think during this innovation project period, utilization rates lower than we would hope.
That is surprising to me because we have never had any referrals to LASSO before the years, and we have 9 or 10, so that should have been up. But this is a combination of programs, so I mean that's a surprising thing because from 0 to at least 9 referrals. Well, I'm mixing maybe some of the Safe Care, but that's surprising that it's going down instead of up.
Well, those aren't just LASSO referrals; those are all sorts of legal services, and so it's not just LASSO.
Anything prior to the project would be any mention of legal services, and then I think we even broadened it, right, Andrew, to include referrals related to things like domestic violence.
Yeah, in ETO we had to cast. So
Oh,
we didn't have a specific indicator for Sooner
that makes more
for
sense.
LASSO, so we had to cast kind of a broader net.
Okay, that makes more sense.
And I know it's subtle, but I don't know if you can see the circle is bigger during the innovation project, meaning more referrals are going out, right? And the vast majority, I think all going to LASSO. It's just utilization is not any different than what we saw historically with that even broader definition. Substance use, this one's really tricky, and I almost tempted to not display it. Because the trial was ongoing, right? You would make a referral, and then they would determine not only if the client was eligible for the service, but then also randomize to decide whether they get the service. So we decided for this plot, for what we're summarizing in the final report, we're just going to focus on whether or not the randomization occurred. This is for the post-innovation project period. And for whatever reason, there was more success with the PAT clients that were referred to PCAP getting randomized than for Safe Care or C1. Okay, I'm going to turn it over to Lisa Deshay next. She's going to run through some survey results with you. Lisa, do you want me to keep the screen up?
Yes, please. Sorry, y'all. I'm having
just to say, objective 4 is a work in progress. Another one of those that wasn't a primary focus, but it's sort of an exploratory analysis that we're doing. I'm hopeful we report that back to you at the next monthly call.
Okay.
Lisa, before you go, this is Susan Wegerzinski. Yep. Hello.
Hello.
Susan.
I just wanted to know if there is additional information on those Sooner Start referrals. Can you drill down a little bit more to see like what was the age of the child at referral, things like that? I would just be curious to know if the majority of those referrals came for children after 2 years of age, which could explain why, because we stop at 2.
Yeah.
Why
if
there
you'll
might
just drop me an email, we can follow
Okay.
up.
Thanks, Lisa.
Okay, so as you know, y'all had completed about 9 surveys over the course of the innovation project, and I've been analyzing those data, and sometimes there's more than one occasion that the same questions were asked, and other times it was a one-time question. So here are some where we asked on 2 different occasions to basically the same group of people, supervisors and staff, and these were true or false questions about what you knew about social determinants of health. And so you can see the graphs look real similar from one occasion to another. So for instance, if you look on the bottom row, the middle graph, are your genetics related to social determinants of health? The correct answer there was no, or false. And so that's why there's a check mark by the pink. And you'll see the pink area grew by the second time we answered that question. So that shows us that there's increased knowledge in understanding the relationship of genetics to social determinants of health, that genetics are not considered a social determinant of health. Next slide, please. Here's another one that we asked on more than one occasion. We were asking, where does Oklahoma rank for rates of adult substance use? And in the legend, you can see the dark pink is the top 10 highest rates, and the dark blue is the bottom 10 highest rates. The correct answers were in the top 10. So the first time we asked that, you see that a little less than 50% of people had said the top 10. But by the time we asked it a second time, y'all had retained that knowledge, and almost 75% of people recognized that we were in the top 10. Next slide, please. Here's another case where we're asking about referrals to knowledge of referral partners, like what kinds of clients may be seen at Sooner Start, for instance, the bottom right, when they would not see a court-appointed advocate. And that's fairly consistent over time, that you retain the idea that no, they would not see a court-appointed advocate. Next slide, please. And this is one about knowledge of substance use screening, and also where things stood before we started most of the PCAP PDSAs. And so, for instance, the bottom middle graph is saying clients would fear losing children if they disclose substance abuse. And you'll see the purple shades are the agree and strongly agree. And so in that middle graph on the bottom row, there's a strong agreement with that. And so, and there's also strong agreement with the top right when the question about screening clients could signal that my clients can talk to me about substance use. And so this is where we were kind of gauging not just your knowledge, but what did you think going into these PDSAs about PCAP? Next slide, please. This is just some true-false items that were asked on a single occasion. Like the third one, everybody got correct, that parents can say no to Sooner Start referral even if DHS made it. And the last one is the correct answer was false. a Unitas location with feedback on a referral would not be found on the supplemental information form. Next slide. And here's some summary questions that we asked at the learning session that we had at the end of September. You see that strongly disagree is on the red and pink, and agree and strongly agree are on the green shades. So the question here, using Unitas improved our ability to follow up with families. There's a little more agreement than disagreement there, but there's not a strong positive endorsement of that statement. The next question, with Unitas, we are better at following up with referred families who did not receive service. There's more agreement there with that question. And then finally, Unitas increased our ability to engage families in PCAP Lasso and Sooner Start. And I would say there's some who are neutral, but a good amount of agreement with that statement. So if you want to see more information on all of your surveys, I've got 2 reports I can send you with more graphs and statistics than you'd ever care to read, but I'm happy to share that. So just drop me an email if you're interested. And while I have the floor, I'll just say that you will be sending out a cancellation of this month's rounding calls. So happy holidays, everybody.
Thanks, Lisa. Okay, Tabitha is going to go next and tell you about some of the qualitative data we've been collecting.
So I'm going to speak through some of our successes and challenges today. I'll try to be brief and focus more on some of the qualitative analysis we've done. Big caveat that we're not complete with analysis. So I'm going to give you general impressions of themes that have come up repeatedly in the data, but we don't have formal analysis complete quite yet. So starting off with some of our expected challenges, as you all are aware of throughout the life of the project, the releases of information were a little bit difficult, and kind of figuring out the consent forms for Unitas, and how that wording would be completed and who would do it. We also note that there are other types of care coordination platforms out there. One competitor is called Find Help. This one allows families to have their own license, whereas in Unitas, as you know, only the providers have it. And then, of course, the common issue of that double data entry, so that you all needed to enter data in ETO and in Unitas to track these referrals. Some unexpected challenges we had were just the complexities that came with the custom forms. For example, you might recall we weren't aware that your providers wouldn't receive some sort of notification when those were updated. So that required kind of manual entry and being sure to go in and check that. We know it was also difficult that some sites had multiple pages in Unitas. So they had their innovation grant page, as well as one they might have had before launch of the project. We also found it ended up being a challenge where some LIAs chose to have all of their staff have a license for Unitas where they were able to use it directly, whereas others, in service of reducing data burden, elected to have a central coordinator who had the one Unitas license, usually a supervisor, which, while reducing data entry, did introduce a middleman and kind of had that separation from getting to use it as intended. And we also found, and maybe lessons learned, we'd love your feedback, but when we tried to disseminate information, such as some of the user guides that problem solved some of these unexpected challenges, or even some of that social determinant of health information and definitions about the eligibility criteria at our referral partners, that it didn't seem that information always got back to staff effectively. So if you have ideas on how we could better inform them, what they might miss at monthly calls other than the email blasts, please let us know. I want to share with you what some of your providers noted as challenges in this project. The ones I'll speak to regarded the training process, barriers to using Unitas, one of the features that they found to be negative, and some of the challenges that were because of the study. In terms of training, about a third of providers spoke about some negative aspects of it, including feeling that they received too much training, since we did this at one of our learning sessions, as well as monthly calls and individual scheduled trainings with agencies. And one noted it was hard to remember what to do when they logged back into Unitas because they needed to use it so infrequently. That person said in this quote, I don't use it a whole lot. So it's like you get trained on something and then 6 months later you have to get into the system. And then it's like, what do I do? It's all brand new again. In terms of barriers to using Unitas, providers noted that you have to remember to check it. So even though it is a technology, you have to choose to utilize it. And they noted it felt like they were losing more of that relational aspect with their referral partners by using a computer to navigate referrals rather than a phone call. So for example, one provider said, I just need to be intentional about going in. So kind of some of the communication side of things may not be utilized, may not. In terms of features of Unitas, I'll get to some of the positives shortly, but in terms of the negatives, we had a number of providers mention the search feature within Unitas seemed to be too extensive or difficult to navigate. So one person shared it wasn't easy. There were so many agencies with similar names. When you're trying to get done with it, it's just like, okay, there's too many options. This is a good example of one of those information pipeline breakdowns we saw, where we tried to share. In Unitas, you have the option to favorite a site, so you don't have to search for it again if you know you're going to continue to refer to them, which would have helped ease that search function difficulty. In terms of study-related challenges, providers noted it was difficult navigating multiple Unitas pages, so having their usual placard and the innovation page. For those who didn't use it themselves, they noted the difficulty of understanding the system if they didn't use it, but instead their supervisor did. And almost no one knew what we meant when we talked about the custom forms or those engagement mile markers. So that additional data we asked to have included in the project. In terms of successes, we just want to know, we felt we had a nice positive working relationship with Unitas throughout. They communicated with us really clearly. They were quick to partner in problem solving when concerns came up. Kayla was eminently available for training and helped create resources when there were questions. And for our end, when we got the data delivery, it was intuitive and quick. We also saw, and hope you saw, that there was progress in relationship building among all the different sites that participated in the innovation project. That there was the option of that resource outreach where on Unitas you can see what other agencies have available. You can also advertise your own. And we saw that the referrals were completed pretty efficiently throughout the life of the project. And then we did have that kind of closed loop communication. As one example of referrals being completed efficiently, this is a graphic provided to us by Kayla that's showing you the number of referred cases that were managed, meaning they were addressed in some way or even closed. We knew it was accepted or denied within 30 days, so within a month. And we found 78% of cases were. So families were getting the answers pretty quickly. In terms of successes, I want to start with sharing what some of the parents said about Unitas and kind of what they thought would be beneficial about a platform like this. These were all families whose case or referral was managed in Unitas. So they noted a variety of advantages that could come with using a care coordination platform. They listed a lot of positives to their provider learning about their referral through the platform, and shared a bit about their personal experience. In terms of advantages of a care coordination platform, parents said that there's an emotional benefit to that, not having to be the one to seek it out themselves and retell their story or why they have a service need. They also thought it would be time saving to be able to use a centralized platform. They liked that there could be up-to-date information about the client to help contact attempts. that it represented a resource hub where it'd be easy to search for resources and that communication on the platform could be easy. As an example, one caregiver said, overall, it could potentially lead to where people could have more or get more services just because the provider is not having to follow back up constantly to try to make sure the service has been provided and the person has been reached. In terms of provider knowledge, parents liked it that their provider could be updated about their referral status through Unitas because they thought that meant their provider could support them in finding next steps if they realized the referral is stalled or it was denied. They felt this removed their own responsibility to update their provider about what's going on with referrals. They liked that their providers could be updated in a more timely manner. So rather than waiting till their next visit, which might not be till next month, that their provider would know in real time what happened to that referral. And they felt if a referral was denied, it would be nice to have to reduce how much they'd have to talk about that experience because their provider would already know about it. One caregiver said, just her knowing it can give her time to think about how to go about the next step before she sees me. In terms of their personal experience, by and large, parents talked about the ease of the referral placement, that their providers provided knowledge about what Unitas was, that the screening process was easy, and that they knew why their provider was making a referral in Unitas. One caregiver said this was one of the easiest referrals I've ever been able to get through and fairly quick at that. In terms of successes from the perspective of our providers, they spoke to the training in Unitas, the families they served, their experience and engagement in the service, getting that care coordination or closed feedback loop, and what features of Unitas they did like. In terms of training, 9 out of 10 of the providers we spoke to spoke positively about the training. They noted in particular that it was flexible to schedule with Kayla, and that it was really helpful to that in training, they went through a case scenario example. In terms of the family experience and engagement, the providers discussed that families were able to hear from them about referral updates and receive support, just like caregivers thought that could be an update or a positive, and that engagement in services was improved through improved network trust. For example, one provider said, engagement slightly improved just because if I have more confidence in the referral source, because I say, hey, I'll let you know, you don't have to do anything. Like, I can go in and put this resource in. So this provider noted knowing that more about the referral partner and what would happen improved their willingness to refer there. In terms of that closed feedback loop, providers discussed the benefits of being able to communicate with the referral source securely in Unitas messaging app, and that the referrals were always addressed. For example, one said that referrals that were turned in through Unitas, there would always be an answer. And another said it's improved communication side as far as the access and efficiency for sending a referral out. It's made it easier because once it's sent, it's done. You're not doing a whole lot after that in the process, other than possibly following up if it looks like it hasn't gone through. In terms of features in Unitas that providers viewed positively, they noted the benefits of the secure messaging app feature, the benefit of receiving updates about referral status as they happen, and having access to that larger network of resources housed on Unitas. For example, one said, I think with Unitas, we're able to get messages through the app. I think that's beneficial because everything is staying together. And another shared, there are plenty of times, a long time before Unitas, you send a referral and you didn't know what happened, or if they were going to be contacting the person. And sometimes the client cannot really tell you if somebody called them or not. Very briefly, these are some of the positives our team of liaisons shared when we asked them about their view of how the project has gone. So they also noted the messaging system was very helpful because it was quick and secure. They're able to get connected. That they appreciated the real-time receipt of referrals, and that referrals, because they were existing on an online platform, didn't get lost. If it was like on paper, on someone's desk, if there was turnover, or if they were out of office, that they liked access to seeing what other organizations could provide with updated information about eligibility, that the referrals were high quality because you could attach documents and include a lot of detail. And overall, that Unitas responded quickly when we had questions or concerns. I will pass it back over to David.
Yeah, thank you, Tabitha. So again, that's feedback we got from individuals involved, your providers, a subset of your providers, a subset of your clients. Questions or comments about what Tabitha just presented? So, the 30-second summary here doesn't do justice to the whole project, but it does sort of solidify in my mind that we're on the right path here. And, we thought from the outset there were sort of at least 2 secret ingredients to make this work, make it work beyond what we had seen previously with other attempts, one of which is having a web portal system like this that would enable us technically to have these two-way communications. It wasn't perfect. There was double entry involved. The customization forms were not easy to work with, user-friendly, but it was possible, and we could do it as long as we had that ROI in both directions. The other key ingredient is having that human touch still there, and the liaisons, we think, again, are part of the secret sauce, being able to shepherd these referrals through the system and then bring up points of awareness on both sides that this is where we're at, what do we need to do to get to the next step of advancement. 2 steps forward, 1 step back. So sustainability, we have 4 minutes to discuss this. We can't cover it all. One of the things I definitely want to make sure that you're aware of is there's been a recent decision at the health department about the licensing of Unitas. And John, if you're still with us, I think I'm going to call on you because you know this better than I do.
Yes, so unfortunately, our agency leadership has pivoted to not renew the Unitas licenses through the OSDH contract. We're hoping to sustain those nonprofits that are still interested in maintaining their Unitas accounts we're going to look through and see if we can sustain those. But the overall big contract that we usually have will not be renewed, unfortunately.
So that's hot off the press and will affect some of you, but we hope not all of you. Again, we feel like this is a mechanism for you to have some of this two-way communication that is so desired and seems to be from your clients and your providers advantageous to the whole process. But Unitas may not be an option for you, not in the immediate future. The PCAP news is also fresh, and I think we're still processing it, even though we've noted internally for a couple of weeks now. What are the full ramifications there? There's a dearth of services available for substance using clients, and now there's 1 fewer than there was while we were doing this project. So again, another step back, sadly, for the system and the communities on the whole. Definitely want to make sure we follow up Patty on that client and any others that this group hears about that are struggling to find new services. We'll do the best we can and sort of the liaison with the PCAP program to make sure their resources are transitioned over to those clients. With the remaining time that's left, any thoughts or feedback on sustainability? I will say that it is a section in our final report that we'll be addressing. I hope to circulate a version of that once it's got clearance at the health department to this group, and you'll have that for your own records. We'd also love for you to read it and provide commentary to us. We'll not only disseminate that for the deliverable of the grant and get it back to the funding agency, the federal funding agency, but we will be disseminating the lessons we've learned from this project in a variety of other contexts, including some conferences coming up next year. Manuscripts as well that we've already started thinking about that we'll be writing in the months ahead. Okay, I know it's a lot to process, and we threw it at you. 100 miles an hour there to try to squeeze it into an hour's time. I'll come back to you next month in the monthly call. We'll touch on Objective 4 and where we landed with that. By then, I hope you have some version of the report too that you might be able to digest, and we can discuss briefly on the next call. As Lisa mentioned, given the shortened month and also the ongoing carve out of where we're headed with workforce development, we decided to nix the rounding calls this month. So no rounding call for December. We'll pick those back up in January, and we'll also try to get a scheduled monthly call early in that month so we can touch base. Okay, not hearing any feedback from the group for now. We'll say goodbye for today. Have a lovely Monday afternoon. If we don't hear from you before the holidays, I hope everybody has a wonderful holiday break. We'll see you in January.
Bye, everybody.
Thank you.
Bye.